My name's Iain. I'm a physiotherapist by background. I work at Australian Catholic University in Brisbane, but I'm also involved with research at CP Achieve and the University of Queensland. And today what I'll talk through is Paralympic sport for people with CP. I'll give a bit of a research update, some opportunities and challenges to look out for as we kind of lead up to the Paralympic Games, which starts next week. So by way of background, a bit of history on Paralympic sport. It actually originated in 1948, so just following the Second World War. The Olympic Games were on in London, and there was a doctor who worked at Stoke Mandeville Hospital called Ludwig Guttmann, and he organised a sports competition for injured soldiers at the hospital. And you can see in that picture there, that was how it kind of started, with people throwing javelins from their wheelchairs. And sports started as a tool for rehabilitation, and I think that's what I'd like you to remember. And then it grew into kind of recreational sport, and then into competitive sport, and it's evolved massively since then, obviously, and it's grown in momentum and scale, and it's now the Paralympic Games is one of the largest sporting events in the world. So there'll be nearly 4,500 athletes in Paris this year, and over 4 billion in cumulative global TV audience. So it's a big event. And specifically on parasport for people with CP, people with CP are eligible for 17 of the 22 Paralympic sports. So if you have a look at the games, it's more than likely that people with CP will be eligible for those events. And there's increasing evidence, of course, for the benefits of participation in sport. It's an avenue for accumulating high-intensity physical activity, so benefits for fitness and strength. We published a paper this year called The Power of Parasport, which really focused on maintaining gross motor function during adolescence. So this was quite a small study, but we kind of tracked a small group of people over 4 years, between the age of kind of 15 and 16 up to the age of 19 and 20, and looked at their progression of gross motor function, or their maintenance of gross motor function, in a period where typically you'd actually expect a decline to occur in those years. So sport was a way of maintaining that positive effect on motor function. There's also evidence for developing physical literacy through sport. And we hear a lot about, obviously, the opportunity to form friendships and social belonging through sport as well. So really, at this point, it's more than just nice to be involved in. Physical activity is an essential component of healthcare and preventing secondary physical and mental health issues. And what we're finding is that sport can be a really effective vehicle for actually accumulating health-enhancing volumes of physical activity. But it's not without challenges, in parasport. So just to give you a bit of insight at a high level, classification is a challenge. So if you're not familiar with classification, if you look at the games, you'll see people competing in different classes against people with around about the same amount of or similar disability to them in their class. And the aim of classification is to get those classes together to minimize the impact of impairment on the outcome of competition and create a fair competition, essentially. But actually doing that is quite difficult. Classification systems don't really account for multiple impairments. It's usually just one. So the result of that commonly is that there's few athletes with complex disability, because they're actually disadvantaged in their class against people who only have one type of impairment. And then what about cheating in classification? Well, it's known as intentional misrepresentation. It's a problem, but really it's a small scale problem, but it can be quite devastating for other athletes. And at the moment, we don't have good methods of detecting intentional misrepresentation in parasport, and it's really an area in need of development. Parasport isn't particularly inclusive either. It's not, the classification systems are not inclusive systems, and many people with disability are actually not eligible. So it's quite large groups of people with, say, autism spectrum disorder, developmental coordination disorder, or any kind of developmental delay, who wouldn't be eligible. Now, there are other sport pathways kind of developing. So we've got the Special Olympics for people with Down syndrome. The Virtus Games is for people with intellectual impairment. We've got the Deaf Olympics for hearing impairment, and the Invictus Games for veterans with disability. But really, there is development needed in those other pathways. The Paralympic Games can't do everything, but we need to invest in other kind of competitions so that there are opportunities for all people with disability to compete in sport if they want to. And there's also, the barriers to participation, which are relatively well known now in terms of the environmental barriers, but potentially also attitudinal barriers too. So as a kind of a way forward, I'd like to touch on the key role of kind of health professionals and actually bringing sport and rehabilitation back closer together. So I mentioned that at the beginning that the Paralympic Games was kind of born through rehabilitation. And I think we should do better now at bridging the gap between sport and healthcare provision. We're seeing now more evidence for practitioner-led sports groups, so particularly in physiotherapy. I think there's certainly room for allied health professionals to work collaboratively with coaches. And new methods of care and service provision through the NDIS, I think, is a good opportunity to bring coaches and therapists working closely together in the community, not in a hospital, but in the community, because that's also where people are telling us that that's where they want to be active and involved in sport. There's kind of an opportunity to do this now through Paralympics Australia. So Paralympics Australia is the National Paralympic Committee and the main stakeholder for Paralympic sport in Australia. Now, their budget has doubled, and there's likely to be significant kind of further investment up to 2032 when we have the Games in Australia. And just to expand on that a little bit, to give you some of the ideas about what Paralympics Australia would like to do over the next few years, I thought I'd just show you some of their strategic initiatives. So Paralympics Australia is interested in developing talent, obviously for sport, and medals is a primary measure of success for them. But that also, taps down to grassroots sport entry and community-based sport as well. So they want to pilot multi-sport approaches to help progress athletes. They want to enhance the ability of the national sports organisation. So that's things like Athletics Australia, Swimming Australia, Cycling Australia to deliver better coaching for athlete development. They also want to increase classification opportunities, so more opportunities for people to be classified so that they can compete in parasport, and expand the national classification workforce. So there'll be opportunities for health professionals to become classifiers, which I think is a very helpful thing to do, because it bridges the gap then between clinicians working in rehabilitation and their involvement in parasport. They're also interested in innovation and establishing an improved research agenda and a better framework for PhD programs, and to continue to advocate for Paralympic sports research. So I think if they do all these things, what we should have is really more pathways into parasport, more local programs, and hopefully better classification processes and opportunities. So if you'd like to keep an eye on that, Paralympics Australia's website there, they have a how to get involved section. So I'd recommend visiting that if that's of interest, either as a health professional or as a person with a disability or anyone else who's kind of invested in disability sport. So what could hosting the 2032 Paralympic Games do for Brisbane and Australia? There's a lot of this discussion going on now. And it's a good time to think about this as we watch what happens in Paris, because sport gets people talking. We've seen that recently with the Olympics, and everyone becomes an expert in one obscure sport that they've never watched before for a few days, and then we all move on and forget about it. But temporarily, sport gets people talking, and the Paralympic Games will bring visibility to people with disability, even if that only happens for 2 weeks while the Games is on. But obviously, we want that to extend beyond the Games. And we often hear the phrase Paralympic legacy, or what was the legacy of the Games? And we don't really know what that means. And the lasting benefits of either having a Paralympic Games or hosting a Games is pretty unclear. I think perhaps in Australia, we won't really know about this until maybe 10 years following the Games. But it's important to think about the preparation that's going on in Australia to host the Paralympic Games now, because that's occurring between now and 2032. And there's big opportunities that we're seeing in Brisbane now with the infrastructure that's being put in place. So if you think about, there's 4,500 athletes with disability coming to Brisbane, we need accessible transport. We need an accessible athlete village. So the potential to build accessible accommodation, as well as training facilities for people with disability, with universal design, so that anyone can use these training facilities, will be a massive help to overcoming the environmental barriers to participation that we so commonly see. And this work's happening now, really. It needs to happen now in the lead up to 2032. The other opportunity here is the people in the program. So there's an opportunity to develop greater expertise in parasport. And I think that's where I think health professionals can access more experience in parasport and bridge that gap a bit more effectively than we currently are, to really become leading experts in sport entry, parasport coaching, and athlete support services for people with disability. I think there is potential for new models of care and interprofessional collaboration between the sports sector and the health sector, which would be somewhat unique. And I think Australia is probably really well placed to do it. So last thing I'll say is just what to look for in Paris and beyond. So have a look at the Australian team size and the demographics. This kind of infographic is from Paralympics Australia as well. And where they are in Sydney 2000, there was probably as good as Australia have been. They won a total of 149 medals from a team size of 286 athletes. Tokyo was much smaller, so they were down to 80 medals from 174 athletes. They've set this public target of 150 medals from 300 athletes at Brisbane 2032. So they want the biggest team size, and obviously the highest number of medals at 2032. That's their ambition. So we'll see if they can achieve that, but it will require some investment in disability sports. Have a look at the range of events available, and also the disability that you see or not see, for that matter. And also listen to those athletes' stories. I think it's really important to listen to people who are doing this now, so that we can learn from them and try and help others to try and be as good as they can be, at the very least in sport, if that's what they'd like to do. And with that, I'll say thank you very much for listening, and enjoy the games. They start next Thursday, the 29th of August. That's when the first events begin. Thank you.